One of the hardest conversations I have with older patients usually starts with a simple sentence. Doctor, I don't feel as steady as I used to. Not because they're in pain, not because they suddenly can't walk, but because something has quietly changed. Their body doesn't move the way it used to. Many people assume that's simply part of getting older. Sometimes it is. But sometimes your walking pattern is one of the earliest clues that something else deserves a closer look. This video isn't meant to diagnose you or frighten you. It's meant to help you recognize changes worth discussing with your physician. Today, we're going to walk through 8 reasons your gait or balance may have changed after 60. Some are gradual, some can appear suddenly, and understanding the difference could matter more than you think. Stay with me until the end, because the last one is something every family should know. Let's start with the first cause. Number 1, peripheral neuropathy. This is one people dismiss the most because it doesn't feel dramatic. It feels like your feet are just a little numb, or like you're wearing thick socks when you're not. Some people describe it as walking on pillows. Underneath, what's happening is that the small nerves in your feet and lower legs are sending weaker or distorted signals to your brain. Your brain relies on that feedback to know exactly where your feet are in space. So when those signals are unclear, your balance becomes unclear too. Let me tell you about a patient I'll call Walter. Walter was 72, active, still mowing his own lawn. He noticed his feet felt a little tingly in the evenings. Nothing that stopped him from doing anything. But his wife noticed he was starting to shuffle, especially in low light. He came in mostly because she insisted. It turned out his blood sugar had been quietly elevated for some time, and it was beginning to affect the nerves in his feet. If you're noticing numbness, tingling, or a muffled feeling in your feet, that's worth bringing up at your next appointment. It doesn't need to be an emergency visit. But if numbness comes on suddenly, especially on one side of the body, that's different, and we'll talk about why in a few minutes. Number 2, inner ear balance disorders. Your inner ear is a tiny but powerful system that constantly tells your brain which way is up. When it isn't working quite right, the ground can feel like it's tilting, swaying, or moving beneath you, even when you're standing perfectly still. I think of a patient I'll call Dorothy. Dorothy came in because she'd started holding on to furniture as she moved through her kitchen. She hadn't fallen, but she said the room felt tippy some mornings. It turned out to be a common and very treatable inner ear condition. With the right guidance, most people improve significantly. If you notice spinning sensations, a feeling of unsteadiness that's worse when you turn your head, or a general off-balance feeling that comes and goes, that's worth mentioning to your doctor. It's common and it's often manageable. Number 3, arthritis in the hips and knees. This one tends to sneak up gradually, so gradually that people adjust their whole walking pattern without realizing it. You may start taking shorter steps or favoring one leg slightly simply because it's more comfortable. Over time, that new pattern becomes your normal, even though your body is compensating for pain or stiffness. I remember a patient named Harold. Harold told me his walking hadn't changed at all, but when I watched him cross the room, he had a subtle limp he wasn't even aware of. His knee had been stiff for months, and he'd simply adjusted around it. If you notice stiffness, especially in the morning, or if you catch yourself avoiding stairs or uneven ground, that's a good time to talk with your physician about options, many of which don't involve surgery. Number 4, muscle weakness from inactivity. This is one of the most common and most fixable causes of unsteady walking. Muscle naturally becomes harder to maintain as we age, a process called sarcopenia. If activity decreases, even for practical reasons like recovering from an illness or a busy season of life, strength can decline faster than people expect. Patricia, a patient of mine, spent 6 weeks recovering from a bout of pneumonia. She hadn't been able to do much during that time. When she was finally feeling better, she noticed her legs felt weaker than they should, and getting up from a low chair took real effort. That's a very normal response to time spent resting. And it's very responsive to gradual guided movement. If you notice your legs tire more quickly, or that standing up from a chair takes more effort than it used to, mention it to your doctor. Often, a simple, safe strengthening plan can make a real difference. Number 5. Vitamin B12 deficiency. This one is easy to miss because the symptoms can feel vague. Tiredness, mild balance changes, occasional tingling in the hands or feet. B12 plays an important role in nerve health, and low levels can affect coordination and balance over time. I had a patient, Margaret, who described feeling a little foggy and a little wobbly, nothing specific enough to worry her, until her daughter noticed she seemed unsteady getting out of the car. A simple blood test showed her B12 was low. With appropriate treatment, guided by her physician, her symptoms improved. If you've been feeling unusually tired along with any balance changes, this is a simple, inexpensive thing to ask your doctor to check. Number 6. Medication side effects. This is one of the most overlooked causes, especially when someone is taking several medications for different conditions. Certain medications, on their own or combined, can affect blood pressure, alertness, or coordination in ways that show up as unsteadiness. Frank, a patient of mine, had recently had a new blood pressure medication added. He mentioned feeling briefly dizzy when he stood up quickly. That's called orthostatic hypotension, and it's something his physician was able to adjust for. If you've started a new medication and noticed changes in your balance, please don't stop the medication on your own. Bring it up with your doctor or pharmacist. They can review your full list and often make it safer. Number 7. Parkinsonian movement changes. This one tends to develop very gradually, which is part of why it's often missed early on. Family members sometimes notice it before the person does. Smaller steps, arms that swing a little less when walking, a slight stiffness or slowness in movement. I think of Robert, whose wife mentioned that his handwriting had gotten smaller and his walk seemed a bit more shuffling over the past year. Robert hadn't noticed it himself. An evaluation by a neurologist helped identify what was happening and start him on a path of management. Early recognition matters because there are effective ways to manage symptoms and maintain quality of life. If a family member mentions changes in your walk, posture, or movement that you hadn't noticed yourself, it's worth taking that seriously and scheduling an evaluation. Number 8, and this is the one I want you to remember most: stroke or transient ischemic attack warning signs. Everything we've discussed so far tends to develop gradually. This one is different, and the difference matters enormously. If someone suddenly has trouble walking, especially alongside facial drooping, weakness on one side of the body, slurred speech, sudden severe dizziness, or vision changes, that is a medical emergency. This is not something to wait on, monitor, or schedule an appointment for. Call emergency services immediately. Every minute matters when it comes to stroke care. Eleanor, a patient I cared for years ago, described suddenly feeling like her left leg wasn't listening to her while she was in the kitchen. Her daughter noticed her face looked slightly uneven and called for emergency help right away. That quick action made a real difference in her outcome. I share her story because recognizing those signs and acting immediately can change everything. So to summarize what we've covered today: peripheral neuropathy, inner ear balance disorders, arthritis, muscle weakness from inactivity, vitamin B12 deficiency, medication side effects, Parkinsonian changes, and stroke warning signs are all things that can affect the way you walk after 60. Most of these develop slowly, and most of them are manageable or treatable once identified. That's the reassuring part. But please remember the difference between gradual change and sudden change. Gradual changes deserve a conversation with your doctor. Sudden changes, especially with facial drooping, one-sided weakness, slurred speech, severe dizziness, or vision changes, deserve immediate emergency care. If anything in this video reminded you of yourself or someone you love, please don't brush it aside. A short conversation with your physician today could make a meaningful difference down the road. If you found this helpful, consider subscribing for more evidence-based senior health education and share this with someone who might need to hear it. I'm Dr. Alan Mercer. Thank you for watching. Take good care of yourself, and I'll see you in the next video.